Hey everyone, welcome back again to our head and neck anatomy series. Today's topic is about the muscles of soft palate. It's very important topic. You have to focus. We have in this topic too many questions coming in your board exam. Definitely. First of all, I want to give you a short information about the soft palate. The soft palate is joining the hard palate as you see in this photo. Here is the hard palate ending here at this point, and the soft palate here is a purely muscular structure. It joins the hard palate in the palatine aponeurosis, or as we say in the removable prosthodontics, and the vibrating line joining the soft and the hard palate. So it's purely muscular structure. It doesn't have any bony structures, and it forms the floor of nasal cavity. Here we come back to the photo. Here we see that the soft palate here, and it forms the floor of nasal cavity, which is here, and this is the roof and this is the floor. It's connected to the hard palate, as we said, in the aponeurotic tissue called palatine aponeurosis. We move to innervation of soft palate muscle. We said in the tongue muscles, we said that they are innervated mainly by cranial nerve number 12, and one exception is palatoglossus muscle is innervated by vagus nerve. In soft palate muscles, they are mostly innervated by vagus nerve, which is cranial nerve number 10, and we have one only exception by cranial nerve V3 or division 3, which is mandibular nerve, is the third division of trigeminal nerve. What are the muscles of soft palate? We have 5 muscles: palatopharyngeus muscle, musculus uvuli, and tensor veli palatini, and levero veli palatini, salpingopharyngeus muscle. You have to memorize all the names of these muscles. Next, we'll talk about the palatopharyngeus muscle, which is our first one. Here in the diagram, we can notice that the origin of it is the palatine aponeurosis in this area, and the insertion from its name pharyngeus, and it means the lateral pharyngeal wall. Here some textbook mention that they attach to the upper border of thyroid cartilage. So now we know the origin and insertion. Let's talk about the action of it. From the insertion to origin, it pulls up the pharynx and the larynx upward movement. I want to tell you some important information about the palatopharyngeus muscle. We see here the palatine tonsils. Behind it, we can find this arch, which is palatopharyngeus arch. It's mainly formed by the palatopharyngeus muscle, but anterior to this tonsil, we can find the palatoglossus muscle of the tongue. So the palatopharyngeus muscle, it forms the palatopharyngeal arch and the posterior pillar of the fauces, but the palatoglossus muscle is in front of the palatine tonsils and it forms the anterior pillar of the fauces. Fauces means the throat. So the palatopharyngeus muscle is behind palatine tonsil. It forms the palatopharyngeal arch, and it marks the beginning of the pharynx, and it's the posterior pillar of fauces, but the palatoglossus muscle is the anterior pillar of Fossils, let's revise the origin is palatine aponeurosis. Insertion is lateral pharyngeal wall and upper border of thyroid cartilage. Action is pulling up pharynx and larynx. Innervation is by cranial nerve 10. Let's move to the second muscle, which is very easy, musculus uvuli. It originates, as we see here in the photo, is coming from the palatine aponeurosis and inserted into the uvula, and the action is shortening. Shortening means retraction of the uvula. Once the uvula is retracted, it broadens. It comes larger. This helps in closing the nasopharynx during swallowing. Here we finished the muscular uvuli. It originates from palatine aponeurosis, inserted into the uvula. Action is shortening or retraction and broadening of uvula to close the nasopharynx during swallowing. Innervation is also by cranial nerve number 10. Third muscle is tensor veli palatini, which is very important muscle, the tensor veli palatini muscle. Tensor veli palatini, as we see in the diagram, it comes from the cartilaginous part of auditory tube and the scaphoid fossa. Scaphoid fossa is just above the pterygoid fossa, and it's inserted into the palatine aponeurosis, and we can conclude the action of this muscle. It's from the insertion to origin, so it makes tension on the soft palate, and in relation to the auditory tube, it causes the opening of it. What is the benefit from this action is to equalize the air pressure between the middle ear and nasopharynx. So innervation is the first exception, is V3. Origin is scaphoid fossa, cartilage part of auditory tube or Eustachian tube. Insertion is palatine aponeurosis. Action is tension and opening of auditory tube to equalize their pressure. I have some important notes to tell you about the tendon of tensor veli palatini. It hooks around the pterygoid hamulus, and the tensor veli palatini is the muscle responsible for formation of palatine aponeurosis by joining the right and left muscle across the soft palate in the area called palatine aponeurosis. This information is definitely coming in your board exam. Which muscle makes hook around the pterygoid hamulus is tensor veli palatini. Which muscle is mainly responsible for formation of palatine aponeurosis? The answer is tensor veli palatini. Let's move to levator veli palatini. Levator veli palatini here in the diagram. It's also from the cartilaginous part of auditory tube, and a second origin is petrous part of temporal bone. It's inserted into the palatine aponeurosis. Action is elevation of the soft palate to close the nasopharynx during swallowing. One question may come to your mind: why does the tensor veli palatini not cause elevation of soft palate? When you notice here, this insertion cannot help this muscle to elevate the soft palate, but the insertion of levator veli palatini definitely helps to elevate the soft palate. So let's revise. The origin is cartilage part of auditory tube and petrous part of temporal bone. Insertion is palatine aponeurosis. Action is elevation of soft palate to close the nasopharynx during swallowing. So, the musculus uvuli and levator veri palatini are complementary muscles. So, when we want to close the nasopharynx, the levator veri palatini elevates the soft palate and musculus uvuli broadens the uvula and nasopharynx during swallowing. Last muscle is salpingopharyngeus muscle. Salpingo means Stichian or auditory tube, so the origin is cartilaginous part of auditory tube, and the insertion, as we see here, is the palatopharyngeus muscle. So the action will be helping the tensor veli palatini to equalize the air pressure between the nasopharynx and the middle ear. So I want to tell you important information. Salpingopharyngeus muscle and tensor veli palatini are complementary muscle. They open the auditory tube to equalize the air pressure, but the levator veri palatini and musculus uvuli are complementary muscles. They are responsible for closure of the nasopharynx during swallowing to protect you or to protect the airway from ingestion of any food. So, salpingopharyngeus muscle origin, cartilage part of auditory tube. Insertion is palatopharyngeus muscle. The action is helping the tensor palatini to open auditory tube for air pressure equalization. Here we reach the finish of the video. Thank you for watching. If you want to know more about dentistry or your preparation for your board exam, please support my channel with like and subscribe. Thank you for watching and goodbye.